So my name is Arjun. I work at Napiers and have done for the last 2 years now. And I have the pleasure of sitting down with Wendy Kelly, who is, well, I will say expert in menopause in terms of the herbal space, because you do see a lot of women, even more so, I would say this year it's really kind of pushed on, and it's great the work you're doing to support those women. And so Wendy is our kind of in-house expert really when it comes to menopause, but all of our herbalists are excellent in terms of knowing the symptoms and signs of menopause, and also how to treat it more naturally. So I won't talk too much myself. It's going to be quite a conversational style of webinar, and Wendy's going to take the lead in terms of giving you guys all of the information that you need. And for those who have just joined, we will be having a Q&A more at the end. So do send your questions in, we'll collate them, and we'll go through those in the last 15 minutes or so. So Wendy, if you'd like to introduce yourself.
Yeah, okay. So yeah, as Arjun said, I'm Wendy Kelly. He likes to say I'm an expert in menopause. I like to say I'm a menopausal woman who happens to be a herbalist, so that might help with my qualifications a bit. But it's definitely something that has been something I've treated since I qualified in 2002. And in those days, I was not a menopausal woman, but it's definitely something that has brought women to see herbalists for a very long time, and way before 2002. Obviously, it's more in the news now, it's more talked about, which is great. But it's something we've always put a big focus on, as there's a lot we can do herbally to help. So yeah, hence this webinar. Hopefully it helps.
Absolutely, and I think it's a good point about obviously you being someone who has gone through the menopause. It really helps you to sympathise and empathise, I think, with your patients. How was that journey for you? Just before we kind of start, just like to get your own experience.
I mean, empathy is so important for any practitioner, and even before I was going through the journey myself, I would like to think I'm quite an empathetic person, but I have got empathy in spades now. So I am, how old am I? I am 52.
It's when you start forgetting.
Am I 52 or am I 51? I think I'm 52. And I am bang slap in the middle of it all. So I haven't got my T-shirt and official certificate yet, so I am still classed as perimenopausal. So that basically means the run up to actually your periods finishing completely. And I won't get my certificate and my T-shirt until I have had no periods for 1 year.
Is that the official?
That's the official.
Okay.
That's when you get your T-shirt and your certificate. And I think you should get a trophy and a medal as well. So yeah, I'm on that journey now. But perimenopause can start all kinds of, it depends on each individual. It can start without, some women won't even be aware of it at all, and then realise they haven't had a period for a long time. Other women, it can go on for 10 years. So yeah, it's an individual thing. So you might start noticing changes up to 10 years before you have your official menopause.
Interesting. So that kind of is, I guess, the start of the discussion. Particularly for me, I am obviously quite removed from it. My mum has gone through it, or is going through it as well at the moment. And so we've kind of discussed it on the surface level, I guess, as a family. But I think education is massively important for people outside of just the women themselves, because it does impact the whole family, and often the mum is usually, or the woman is usually the one looking after the younger family, so the kids, the husband as well, or the partner, and then also parents that are getting to an age where they also have to look after them. You kind of squeeze in the middle and often forgotten about, I think. And so I think a really good question to start with is, what is the menopause, and typically what age does it occur? Because from what I've heard and the little knowledge I know, it can happen a lot earlier than what many people might think.
Yeah, absolutely. So I am pretty much bang average. So 51, 52. I think the average officially in the UK is 51 and a half, something like that. But yes, it can happen a lot younger, it can happen a lot older. I've had patients who are 56 still having periods. I have got much younger patients who come in, and there are different types of menopause as well. So what I'm going through is a natural menopause, but you can also have a surgical menopause. So that means that you have had an operation that has removed your ovaries, which means you can no longer menstruate, you cannot, so that's a surgical one. There's also other types of medical menopauses. For example, you might be given medication deliberately to stop periods and put you into an artificial or chemical menopause. That can sometimes happen for things like endometriosis sufferers. And also it can happen as a side effect of other medical procedures. For example, when you have chemotherapy as well, that can put you into menopause as well. And breast cancer survivors are given estrogen blockers as well if they've had an estrogen-fed cancer. So, there are lots of different types of menopause. Early menopause can also happen naturally, sometimes runs in families, so that would normally, anything before sort of age 44 would be classed, I would say, as an early menopause.
Okay, great. And from my understanding, it is typically hormonal. You've mentioned obviously quite a few different situations where it might not necessarily be just limited to the hormones as well. But when it is related to hormones, what are the key hormonal changes that sort of take place? Basically,
what's happening is your ovaries are down-regulating, so they're starting to slow down and they don't produce as much of the sex hormones as they would normally. So that is your estrogen, which is talked about a lot. There's also progesterone, and one that's now coming more to the fore that used to be ignored a lot is testosterone as well. So all of these they're basically getting lower and lower and lower. However, as you go through the perimenopause, it's not just a nice smooth journey down like this. You can have a lot of this going on, and that's quite often where a lot of the symptoms come from. So you can be having surges of hormones and then sudden drops, and it can be a bit all over the place.
Okay, interesting. That's really good. And then what does that kind of lead to in terms of the symptoms that you're talking about with the changes in hormone?
Well, how long have we got, Arjun?
We've got a while. I think so. What we can...
So symptoms can take up quite a long time.
Absolutely. I think so. Some of the more common ones, I guess, are at least the ones that I've heard of, and it'd be really good to know what signs to look for other people. Are things like hot flushes, night sweats, mood changes as well is often one that you can be joked about. I think often, and that's quite a negative thing, which I think now hopefully is becoming less of a topic of people making jokes, hopefully, and then the irregular periods as well. What are things that people should know about?
So those are fairly typical ones, and you see, there is this sort of joke about menopausal women being scary and everything like that, and or standing in a corner sweating, and it's no joke if you're going through it. Absolutely, it's no joke. However, there's nothing wrong with having a sense of humour about it as well, and I think that's how a lot of women cope with it as well, is have a sense of humour about it, get together, have a laugh about it, and a good moan about it as well. I do a lot of menopause workshops and a lot of menopause talks, and quite often I'll have a PowerPoint or I'll have a notice, an A-board or something up. And one of the things I like to do is show them the 7 dwarfs of menopause. And there's lots of different versions, and actually I could probably have about 25 dwarfs of menopause. But so we've got things like sweaty, we've got grumpy, we've got itchy, sleepy, angry, or ragey. We could go on. So hungry, windy.
So it is. So
there's a lot there. So I mean the stereotypical stuff is flushes and everything. That is not. That is a very common one. That and night sweats, fatigue, insomnia, anxiety, low mood, and mood swings. So they're very well known, but there are lots of other symptoms that can come about, and it's incredible to me how much can be attributed to this hormonal change. For example, brain fog is a huge one. It's one that I have to deal with when I'm in clinic. I don't know if you've ever noticed me sneaking off to the shop at 3 o'clock. Is my brain fog moment where I have to go to the shop and I steal the rosemary oil tester and have a good sniff and then come back. That really helps to clear my head, because that's rosemary o'clock is what I call it. 3 o'clock.
I was wondering why we were going to do a lot more rosemary. So brain fog is one of those, and the reason for that is that estrogen actually acts as a neurotransmitter. So in menopause, or perimenopause, when your body is adjusting
It's going, where's this estrogen? It takes a while for the brain to, do new pathways and use other neurotransmitters in place of that estrogen. So brain fog is very much one of the things that can happen. And word finding, which might happen tonight, I might be going, losing words, losing
sort of train of thought.
Names. So looking at someone you've known for years and suddenly you can't remember their name, names of objects, just silly things like that. But, yeah.
That's really interesting. And those symptoms, do they differ from the different stages? And it'd be quite good to know kind of what to look out for in each stage and what really the different stages are.
It would be lovely if we could just do that and go, right, at this point this is going to happen, at that point that's going to happen. It doesn't work like that, and it's different for everyone. Some people will never know what I'm talking about and think that's not part of my journey.
What your experience is, for sure.
Exactly. So it's a very individual thing. And what can happen in perimenopause might also happen for other people post-menopausally. So I've had women in my room saying, I thought I got away with it. I was doing so well, and then suddenly this happened. It can just depend. And I'd love to say it depends on this, and this.
Of course. There's no set criteria. I think the sense that I'm getting is that it is very much an individual thing, and that is the thing with hormones. A lot of the time it is each individual is very unique, aren't they? And so
absolutely, which is why an individualized approach is really effective.
Okay.
Because we can just, what we do is listen and hear and ask the right questions, find out what's going on. And it's amazing how many times a woman will say, I'll ask them, oh, what about this or this? And they'll say, oh yeah, I've got that. I said, well, that could be part of your perimenopause. And they'll go, really?
Okay.
Yeah, there's a lot of symptoms that you might not even realise are part of
what's going on. So does that happen a lot in your clinic where women will come in and, as you say, maybe they have brain fog or nausea or something like that you kind of pinpoint and you'll work out that is actually probably a lot more likely from the menopause. Is that a common thing? It
is quite common, and it can also work the other way around. So sometimes women will come in and say, I am gaining weight, I have no energy, I'm quite low, I'm not sleeping very well, and I'd like some help with this perimenopause. And I'll say, yeah, it could be that. It might also be iron deficiency or thyroid issue.
Okay.
So it's also important not to attribute everything automatically to hormonal changes, because you could miss something. It might be a vitamin deficiency, it might be something more serious. So I quite often ask women to go back to their GP and get a blood test, like a basic, just full bloods, to have a baseline, to just check that there's nothing else going on. Okay. Because you could be feeling dizzy and really tired and spaced out and brain foggy because you're iron deficient. So that would be easy to fix.
Okay.
So it works both ways, and then there's other things that women will come in and go, I've had this frozen shoulder for ages, and I'll go, that might actually be hormonal.
Because I guess that's affecting your muscles and your ligaments and stuff.
Absolutely. So frozen shoulders are much more prevalent in menopausal women.
Wow.
Yeah.
See, there we go. So we did have a few people. So Anna, for example, mentioned that joint pain. Exactly that. What you just said is her biggest issue.
Yeah.
For Kelly, she mentioned the brain fog as well. So absolutely, some of the things that you mentioned have been covered there. And you mentioned a few supplements there. Do you tend to recommend for these women that come and see you to have a set sort of bundle of supplements, or do you think it is again very dependent?
Never a set. No. It will absolutely depend on the individual. It will depend on their lifestyle, on their diet.
Tests that they might have, or sure.
It will depend on what they're eating and how they eat. It will depend on any other conditions they might have as well. Women, menopausal women are still women who have other things going on. They might have other medication going on and things as well. So it absolutely depends. There's some very common ones that I do. I mean, most of the women that come to see me end up on magnesium.
Okay.
That's a really big one for menopausal women.
Yeah,
it does help most women.
Okay.
And in this country, most women do tend to be a little bit deficient in magnesium, mainly because it's low in our soil. It's not, it's not in the levels in our food that it used to be. Even though you have a healthy diet, it might be harder to get the magnesium you need. But it's such an important mineral, and it's a generally very well tolerated and safe mineral. And it's so important in so many different bodily systems. It's great for blood pressure that can go up.
Okay.
That's another one. Joint pain, muscle aches, insomnia, helps with that, anxiety.
The blood pressure one is a really good one because we do get a lot of people coming into the shop and actually, they might have gone to the doctor and their blood pressure is high, and that could be potentially something which I didn't even realise was a thing.
Cholesterol goes up as well, but it can go up as well in menopause.
So that really kind of highlights that it is something that can affect the whole body in a number of different ways, but actually pinpointing it could be very challenging. And what a doctor or even a herbalist might recommend, it could take some time actually to figure out and pinpoint what is the cause of it, but ultimately it might be due to menopause as well. The reason I asked about whether there is like a set supplements that you recommend is because in the UK almost everyone is deficient in vitamin D, for example. If there's a baseline that someone could take just to make them feel a little bit better, but as you say, there isn't anything. It is very much a personal thing.
It's a personal thing. I mean, I think a good quality multivit is always a good start. Again, if you've got a really great diet, then maybe not. But most people probably could be.
And again, and the thing is, again, for the women who are going through this, time is not really a resource you have a lot of. Yeah,
you made a good point at the start. I mean, that's the thing. Like menopausal, the age that it tends to hit us is an age that most women are probably quite busy. They're probably, if they're working, they probably are in a fairly decent place in terms of career at that age.
Sure.
And you are doing a lot of juggling, as you say, between generations. Women, as you know, Arjun, women hold it all together. Generally speaking,
yes.
We do tend to do that. And actually, I would say this is a really good point. So women tend to run on adrenaline a lot, and your adrenal glands. I'm always banging on about adrenal glands in clinic. Okay, so any menopausal woman that comes to me will hear about her adrenal glands, and the reason for that is that when the ovaries start to downregulate your adrenal glands, which are the little glands that sit on top of your kidneys, one on each kidney, they start to produce a small amount of hormones themselves. So it's almost like your inbuilt HRT patch.
Okay, so it's kind of
that's nature's way of doing it. Okay. So that's what happens. However, if you are very, very busy, your adrenal glands are also where your stress hormones come from. It's where your blood sugar balancing comes from. It's where your blood pressure control comes from. It's, the adrenals do a lot of stuff. So women who are what I would call adrenally challenged, it's maybe not a medical term, but that's kind of how we class it, sometimes suffer a bit more in terms of symptoms.
Okay.
So adrenal paying attention to your adrenals is really important in menopause. That's what I would say it's massively important. So women who are looking after their adrenals in the run up to menopause tend to fare better in menopause. The ones that are running about like headless chickens and are stressed up to the nines and just are overwhelmed with life and life admin and whatever tend to suffer a bit more than others. Generally speaking.
See, that is something I absolutely didn't know, and I think that I'm sure a lot of people watching will also be a little bit surprised by that, because often, at least from what I understand, is menopause is something that just happens to you that you don't have a lot of control over. Which obviously there are some limits of what you can do, but actually you're talking a lot about potentially lifestyle changes that can really help to
absolutely. And actually, what normally comes out of the workshops I do is what I really want to get across to women is that you're not powerless. You can take control of a lot of things, and you're not just at the mercy of this.
Yeah, just having to wait over the 10 years or however long it might be.
And it's not to say that, oh well, if you're having a bad time, it's your fault. It's nothing like that. It's just that there are measures that can help that might surprise you.
Okay.
That I talk people through all the time. So as I say, one thing is being kind to your adrenals. So that could look like, the classic stress management stuff, doing a bit of yoga, taking time out, all the rest of it. We all know that stuff. But also looking after your liver. That's the other one as well. But the other thing, another way of taking the strain off your adrenals is balancing your blood sugar levels. Okay, so having almost treating yourself like you're a diabetic. Trying to just really keep your blood sugar very even will stop slumps. It can really help night sweats, and it can help waking up in the night. So I've sent women home without any herbs and given them a blood sugar management diet, and they've come back and they've said that they've basically halved their, or even completely got rid of their hot flushes during the day because they've balanced
so that just requires actually even no intervention in terms of supplements or herbs. Yeah. It's just literally just focusing on blood sugar levels.
And balancing blood sugar levels can mean getting rid of things that are stimulating or that give you a quick fix. In terms of
things
sugar.
like white breads.
Yeah, so refined carbohydrates, sugary, anything that turns to sugar really easily. Caffeine will give you a spike. Nicotine will give you a spike. Sadly, alcohol will too, I'm afraid.
One or two glasses probably okay.
Might have a gin after this. So there's lots of simple things you can do. But if you look into blood sugar management, that's really important. And stress management can make a huge difference to how well you will fare going through.
Fantastic. And we had a question just relating to the adrenal system, which is how do you test for adrenal function, or how would somebody who's interested in knowing understand without doing a full test potentially? I don't know if that's possible.
Yeah, so generally when I'm talking about the adrenal thing, I'm not talking about clinical pathological issues with your adrenal glands. You can get adrenal testing and cortisol, so cortisol is coming out of your adrenals, so you can get cortisol testing done. You can do that privately. I personally don't do lots of these tests, but we do have herbalists that do and nutritionists that do. I would more be looking at that from what someone is telling me about their lifestyle and how they are presenting in my room. So if they're talking 100 miles an hour, they're stressed and their symptoms are showing that they're overwhelmed, busy, those sorts of things. Also, people who have had trauma, even childhood trauma or an abusive relationship, all kinds of things like that, that can really impact adrenals. Bereavement is another one, and that's another one that sadly tends to hit at this time of life. Maybe you're losing parents. You start to lose more people as you get older, and that can really hit the adrenals because the adrenal glands will produce cortisol. They will also produce adrenaline to keep you going through whatever you're feeling, and that cortisol. I should also mention is behind a lot of the weight gain that can happen as well at menopause. That's another biggie. Is
that sort of hormone linked, or is that more
so cortisol?
Lifestyle changes?
So I mean, a bit both. What we'd be trying to do is reduce the cortisol being produced, which is your stress hormone there coming out of the adrenals. So adrenal herbs again can help. So when I talk adrenal herbs, I'm talking about what are often called adaptogens. So things like ashwagandha is one of my big favourite ones, but there's lots of them, and it will depend on the individual.
Which one you might recommend? Okay.
Some are more stimulating that I would only use during the day. Some are better for at night time as well. So
because I guess with the thing with stress is it does present very differently in people. So some people, stress gets them very sort of hyper and irritated, whereas some people might kind of go reclusive and more into their shell.
Yeah, absolutely. Yeah, and often some people might not realise that they're stressed and just be getting on with it during the day, but it might be presenting as waking up every hour and a half, every 2 hours with or without night sweats, or just feeling really anxious when you wake up. Palpitations is a big thing as well in menopause, and often waking up with palpitations can be a thing too. So
Right. So that's really good advice, and I don't know if anyone who is watching, I'm sure you kind of understand and relate to what Wendy's talking about in terms of that level of stress being part of what you're experiencing potentially. So in terms of other lifestyle changes, you mentioned diet, you mentioned trying to manage stress. What else would you sort of exercise? I guess is probably quite a big one.
Again, that's an interesting one because a lot of women will say to me, I've always been really fit and I run and all the rest of it, but the weight is now piling on, and I don't understand why, and I still feel really stressed. And that can be because there's too much cortisol and adrenaline being produced as a result of kind of high impact cardio. So sometimes it's better to switch to different types of exercise at this time of life. Again, it's an individual thing, but weights are good, like light weights are good this time to stabilise joints and to really help with muscle wastage is a big issue in
Of
menopause
course,
as well.
Yeah.
And it's quite scary how quickly it can happen. You can really get quite weak quite quickly, so that can be helpful. Things like swimming can be good. We need to be thinking about our bone health, our osteoporosis risk, that kind of thing too. So
high calcium potentially as part of your diet.
Well, magnesium will take care of that.
Okay.
So magnesium helps you absorb the calcium. In most people, there's a lot of calcium in what they're eating. It's just not necessarily getting into their bones.
Okay.
So magnesium will help that. So magnesium could be coming from things that also have calcium in them. So even things like seeds. I'm a big fan of seeds.
Yeah.
And actually, I normally have a tub, Arjun, in my cupboard. I often show it, and even if they're very nice to me, they might be allowed to taste some of my
seed mix.
Seed mix. Yeah, so just put some in a dry frying pan. Pumpkin seeds.
I think you've done them for us actually in the staff room. I've had some. Oh, they are delicious. Yeah, you maybe have to put a recipe up on the website.
Yeah, toast them just with no oil because they've got their own oils. Just toast them until they're almost popping like popcorn, but not that far. Sprinkle a little bit of tamari or soy sauce and let it cool down, and they're crunchy and salty.
They are delicious. Yeah, I remember now when you brought them in. And
don't eat too many at once though, because it can make you a bit windy if you're not used to it. I've had that complaint, when people have got a bit overindulgent with them.
Brilliant. So I think we've covered quite a lot about the experiences that a lot of women will be going through and what's causing them. So now it will be quite useful, I think, for us to discuss kind of alternative remedies and stuff, products that they can take potentially, and what you would recommend really.
Okay, as I say, it's difficult because over the counter, because women are so different. When you come in to see a herbalist, we write you an individual prescription. So it'd be good actually,
to maybe, because I know what you guys would go through, but it'd be nice maybe for the viewers to outline what you do.
All right. Okay. Yeah. So basically, so there are over the counter things you can do. So we do have some really good products that are worth trying, and we can look at them in a minute. Or you can book in to see myself or one of the other herbalists for a consultation. Now, normally the big difference between going to see a herbalist and seeing a doctor, one of the biggest differences is the time. So normally you have at least an hour with your first consultation, which really gives you time to actually tell your story, get it all out, and the amount of women that say to me afterwards, I just feel better already, and they haven't even taken anything yet.
It's just having that time and someone listening to what you're going through makes a huge difference now what you're going through, whether it's menopause or just anything else.
Yeah, because I see people about all kinds of things, and not just women as well. Exactly. So you will have time to go through that. We'll ask you hundreds of questions. Might be able to feed back to you about, well, actually, this is probably linked to this and this and this. And then we would write an individual prescription. It often takes the form of a tincture. Most herbalists will use a tincture as their kind of mainstay.
Yeah,
like this.
Tincture is just herbal extracts in alcohol, basically. But you can
liquid form.
Yeah,
so liquid form of medicine. So it's handy because we can mix. One of my prescriptions typically would have between 6 and 8 different herbs in it, so we can mix that all into one bottle so you're not rattling. You might be prescribed, I quite like a tea to go alongside a tincture as well, and there might be some supplements too if we think that they're necessary. As I say, quite a lot of women, magnesium, and fish oils is the other one, or omega oils if you're a vegetarian of some description. They can be really helpful as well because they're anti-inflammatory. They're good for moisturising everything, including joints, eyes, mucous membranes, that sort of thing.
Really important for brain health as well, aren't they? Omega-3, which
really
is
important
with brain fog.
Help with the brain fog as well. Yeah, absolutely. So if you went to see a herbalist, we would give you an individual thing, but there are things you can get over the counter. Which one is it? That one, the midlife mix. Actually, that's a good example. That's a practitioner's strength one, and it does have a mix of herbs that you might be a bit familiar with if you've read anything about menopause, or you might have tried a few things over the counter. So this particular one, for example, has sage in it. Now, sage is a really big one for sweats. Okay, so it's good for drying up sweats. It has got a phytoestrogenic side to it as well, so that basically means a plant estrogen, so it kind of locks into estrogen receptors. Gallium is cleavers, or in Scotland it's called sticky willy.
Sticky willy, yes, I remember hearing that for the
And
first time.
it's the stuff you pick and you throw at each other, and it sticks to people's clothes, and they walk about all day and they don't know it's on their back. That's a really cooling lymphatic remedy, so that's a wonderful herb. Red clover is a really
a really popular one, isn't it? I think we see a lot of supplements in the market, and a lot of people come to you, I think, probably with that, having tried it.
Yeah. Black cohosh is another really well-known one as well. Particularly good if you've got joint pain going on as well. And St John's wort is in here as well. St John's wort is a really well-known one for mood. It's really good for bereavement, it's good for low mood, it's good for anxiety, so it's a really nice blend. However, this would not be suitable, for example, for someone that has had estrogen-fed cancer. Okay, because we don't use phytoestrogens, or at least I don't use phytoestrogens there. And that would be a case where you would be much better coming to see a herbalist who can then prescribe for you. So, for example, we might work more on the adrenals and the liver, which will help to support the body through menopause, instead of using phytoestrogenic herbs. So, but this is a really good one if you're on no medication and you don't have any serious history.
And would you class HRT as medication, or would you not really?
So HRT, so a lot of women that come to me are already on HRT, and the reason they've come in is because either they want to come off HRT, or they've been told they have to come off HRT, or it's working for some things but not for others. So we can work alongside it, or we can work to replace it. In that
case, that's why.
But that would be a herbalist would help you do that.
Perfect, brilliant. And I think that is really important to know. Whilst we have got a few products that can help, as Wendy said, over the counter. Really what we want to do at Napiers is help the individual. So these products are made to help as many people as possible in a broad sense, but actually speaking to someone and getting to know their medical history, it's all very unique. But also on top of that, as Wendy's been speaking about in-depthly, is actually the symptoms and what they're going through is also very unique. So broad spectrum, we have a few products which I think we will send some information about afterwards. One of the questions that we have got, we can jump back into the herb side of things in a moment, but it's about which type of magnesium is best, because there are lots of different types of magnesium. Is there a specific one, or actually?
Again, it depends. And what I tend to plump for is one that's a mix. So I quite like the ones that have 2 or 3 different types. I think the Napiers one is a mix, isn't it? Has that not got 3 types?
I can't remember off the top of my head. I think it does.
I think it does. But I tend to use that, or the Lambert's one, that's got a mix as well.
So I don't think the Lambert's one is on our showcase at the moment. That one is, but definitely if we can add that to the information pack.
That's marine magnesium in there, so that's a good one. But there's the glycinate. I would say try not to go for magnesium oxide generally, because that's poorly absorbed.
So it's almost a bit of a waste.
So magnesium glycinate's good, citrate's good, and there's taurate, there's all kinds of stuff. And actually, if you talk to a nutritionist, they would give you all the ins and outs of all the different ones. I tend to plump for one that's got a few of them in there, and it kind of covers most of them. If you find, some people will find that they have a laxative effect, which can be a good thing if you're having issues there. But if it's too much for you, it might be better just changing the type of magnesium you're using. Sometimes it's good to go for a powder so that you can fine tune the dosage as well. You maybe just don't need quite as much. You can also use like sprays. I think we've got one here. Yeah, we can use sprays, so take it externally, so that can be massaged into the soles of your feet, for example, at bedtime to help you sleep. And I think there's a cream as well. So there's all kinds of ways of getting magnesium into you. That's a lovely cream, sleep cream as well. But massage it into the soles of your feet is a lovely way to do.
Brilliant. And it's quite relaxing as well.
There we go. Better,
So you've got your family there who should be supporting through the menopause as well, and they can maybe do
literally
that.
Kneeling at your feet, massaging them.
Absolutely. Great. And what should women consider when exploring alternative therapies for menopause management? So that's, should they consider other lifestyle things that might feed into herbs, or are herbs generally pretty well tolerated?
Again, everyone's individual and different strokes for different folks. Some people will respond brilliantly to herbal medicine. I would say most people probably would, but not everyone will be open to it. So, some people find that acupuncture is really helpful, for example, and it can also be part of like anything that's going to help to reduce stress and improve circulation and that sort of thing is a good thing. Some people will respond better with nutritional therapy or hormonal, not hormonal, homeopathic therapy. So there's lots of things out there. What I would say is just check that whoever you're seeing is suitably qualified, knows what they're talking about, is registered with some sort of body, for whatever field they're in. But I mean, there's lots of ways of doing it, and you can combine these things as well. And as I say, there's also the option of you're already on HRT, but you're not getting everything you need out of it. Doesn't mean you can't do herbs as well, but I would say see a herbalist in that.
Sure,
in that
rather
sense.
than I think as soon as you are taking some medication, there is always an element of risk, and we want to avoid that and proceed with caution.
Even things like the midlife mix. I mean, that's got St. John's wort in it. St. John's wort is a wonderful herb. I use it a lot, but it is contraindicated with a lot of medications.
Okay.
It can potentially make your medication stronger or weaker. It can also interfere with the contraceptive pill, for example. So even if you're on a contraceptive pill, you need to consider what you're taking. It could affect that. And you're maybe not ready for a baby at 49 or whatever. So,
just to be, absolutely. Brilliant. And then I was just going to ask about more of the mental and emotional side of things. Stress is a big one, of course. The other one that you briefly touched on was potentially depression, and how obviously anything hormonal can work against mental faculties, I guess, and how we're feeling. Are there sort of products that kind of cover that, or herbs that cover that, and as part of your... it's a very common one. So anxiety, low mood, and overwhelm is a huge one as well. And I think it is partly to do with where we are in life a lot of the time at that age. So it's definitely something that herbs can help with. So for example, even simple things. So in the morning, having hot water with a couple of slices of lemon, and if you have any rosemary in your garden, get a sprig of that, stick it in, or a rosemary pot in your kitchen. It's a wonderfully uplifting. I talked about rosemary earlier. I do like rosemary quite a lot. But rosemary is a really uplifting and head clearing type herb, and it's just a really nice sort of light way to start the day. The lemon in the water helps to kickstart your liver as well. We really need to look after our livers at this time. There's a lot of hormonal fluctuation going on, and it's the liver that gets hit with that. So rather than reaching for a coffee first thing, have that first. Have that before you have anything else. It's a really nice way to start the day. In terms of herbs to support your mental health, there are loads of them. St. John's wort is a classic one. It's a lovely one, but as I say, it can be contraindicated with quite a few medications. So there's things like lemon balm is lovely, and that actually promotes really good cognitive function. Things like ashwagandha can be helpful as well. It's a really nice one, especially if you're feeling quite anxious and a bit low. There's lots. It just depends on what else is going on, but absolutely lots of things you could do. The rosemary as well is very good for thinning hair, which is another big thing in menopause. And actually, I asked you to bring up nettles because that one. Nettle leaf tea. Nettles are fabulous for your hair, your skin, and your nails. So get onto the nettle tea. Saying that, do not have it too close to bedtime because you will be up all night peeing, and that can also be another issue. So we don't want to make that worse. So have that during the day. But it's really rich in the right minerals, lots of silica in there. It's a great one to get onto during the day. Fantastic. That's really good advice about timing your supplements as well. And there is a question around the best time to take magnesium.
Bedtime.
Okay.
Generally speaking, bedtime, because it can promote a more restful sleep. It can help to prevent the sort of anxious dreams and waking up with anxiety. I think it's meant to be absorbed better at night as well. So it is good. And also, if you are having problems with constipation, if you take it at night, it can help you move in the morning.
So timing is essential with that one.
Timing is everything. Yeah.
Brilliant. And we've spoken a little bit about HRT, and there are obviously some really good benefits, and it does work very well for a lot of people. Are there any? It'd be good to discuss maybe the potential benefits and risks of taking herbs, and how herbs can maybe be a good alternative if people who are watching maybe are considering coming off it or want to supplement it with herbs?
Yeah, absolutely. So, I mean, the big difference between taking herbs and taking HRT is, so you can approach herbal medicine a bit like HRT in that you could say I am trying to replace the hormones that are missing. So that's like phytoestrogens. Okay. However, you've probably picked up from how we've been talking that there's a lot more you can do than just simply try and plug some estrogens into the receptors, and actually by supporting the bodily systems, everything, by supporting cognitive health, the liver, the adrenals, the circulation, the digestion, the gut changes a lot actually in menopause. It's another huge one. We could talk for hours about that. By supporting all of these things, it can actually make your menopausal journey a lot smoother, and it's not just about replacing the hormones. Sure. So yes, it can be helpful, but it doesn't always complete the picture. Okay. So HRT can be a game changer for some women, but some women come to me really disappointed because they've got very excited about maybe Davina McCall's program or whatever, going, great, that's the answer to everything, and it doesn't suit everyone. It does suit some women brilliantly, and that's great. But for some women, it either doesn't do everything they need it to, or it really doesn't suit them. For example, I've had women that got on really badly with the contraceptive pill. Okay. And they found that HRTs had a similar effect, it's just made them feel terrible.
So they may be more
it can happen,
predisposed to hormonal, synthetic hormones or whatever it might be.
Maybe and it doesn't suit. So yeah, so it's just because, so if hormones don't suit you, so if HRT hasn't suited you, or you've tried some over-the-counter herbs and it hasn't suited you, it doesn't mean that herbal medicine won't suit you. It might just mean that you have to go about it in a slightly different way, by supporting other parts of the body and the system. Sure. Yeah.
And that's a good point, because I think I've noticed as well with some of your prescriptions and some of the mixes that you put together is some people, they change from consultation to consultation. So that's you, I guess, working on, they might go away and say, oh, this really improved, but actually I still struggle with my sleep, and then you might adjust your
absolutely,
the tailored blend that they get.
Again, that's a really good point, because menopause is, I've used the word journey, probably overused the word journey, but it is. I mean, it's a constant, it's a change, and it's not just you go from one thing.
These are your symptoms and that's it. Sure.
It changes. So what will often happen with my patients, initially we might have a bit of jiggling about. I like to call it a tweak. We tweak the prescription. So yeah, I normally have a pretty good idea of what I want to give someone the first time they come in. We see how they get on, and I might say to them, right, I'm going to give you just one bottle with these herbs in it. Let's see how you get on. But what we might do is split it into a day and night mix next time if your sleep is not improving. So they'll come back and go, yeah, this is better, that isn't, my sleep's still rubbish. I said, right, great, I'm going to give you a herbal hammer at night. We're going to do some more sedative stuff, settle down that cortisol spiking, all the rest of it. And then we'll do that. Now they might then be great for, I might not see them for a year, and then I'll get a desperate email going, Wendy's next availability? It's all gone wrong. And I'll go, don't panic, because hormone levels change. That's what happens,
Absolutely.
And then you'll get settled for a while, and then we adjust. And that's a nice thing about the herbs, is we can just. So we've got a massive dispensary downstairs.
Yeah, we've got hundreds.
There's
over 200 herbs we've got downstairs. So it's a playground for you.
Yeah, exactly. It's great. But there's loads of things we can do, and we can just sometimes just changing the amount of one herb, the percentage of that herb in the mix. That's all it's needed. Literally changing 5 mils, or changing one herb.
Brilliant.
Yeah, that's sometimes all you need.
And there is one product here which I'm sure we're going to probably get a lot of questions about, which I don't want to cover too much, but just wild yam as an ingredient. Is that something you tend to recommend? I know each herbalist is very different in terms of what they like and what herbs they...
Yeah, so wild yam cream's had a lot of press, a lot of attention, and it's funny because it's not actually one I use very often. However, I do have patients that come and tell me it's great. I've had other patients that said it hasn't done very much.
Yeah.
So it's definitely worth a try. I would say the one time I would use it or recommend it is for vaginal dryness. It can be really helpful for that. But I have had women that it's a cure-all for them, which is great. So it can be used for joint pain, flushes, and things like that. But personally, I normally use internal Tinctures.
Yeah. And actually, I just want to point out as well, what we're talking about, and maybe a lot of the viewers are, if you are on medication and you are on HRT, where it might be, you can try it, but again, do it with caution, and it might be better to do it under a supervision of a herbalist. And really, I think it would probably be better just to if you are in that situation, is to speak to someone to get a more tailored approach, because you might find the custom blend will work a lot better for you.
Yeah. And at the risk of embarrassing you, Arjun, just on the subject of vaginal dryness, because it's one that nobody wants to talk about in the workshops, and I always have to talk about it, and then everyone's glad I did. One really simple thing you can do if it is an issue is use a vitamin E capsule. So you want the ones that have got vitamin E oil in them, a soft gel capsule, 200 IU or a 400 IU. You can use that as a pessary a couple of times a week, and it can be really, really helpful. And another supplement that can be helpful for that and for other types of dryness, for example, eye dryness, sinus dryness, mouth dryness, even itchy ears, is omega-7, which is sea buckthorn oil as well. That's taken orally. Okay, so that's another quick tip.
Excellent, brilliant. We have slightly overrun on our discussion, but
always happens.
But we've got about 11 minutes to do some questions, some Q&A.
Okay.
So just before I get into the questions, if you do have something specific, Wendy does offer some free 15-minute consultations, but I imagine you're pretty booked up kind of at least 2 weeks in advance. Normally, but check that out on the website. The link will be in the chat. There are other herbalists who do offer the free 15-minute, and again,
they'll be able to answer.
They'll be able to answer some questions about the menopause as well. The other thing to note is the herbs that Wendy has spoken about might not be the ones that other herbalists recommend from Napiers. Like, each of our herbalists are very unique in their sort of background, their training. They all have their favourites, exactly. So it'll be good to discuss those with your herbalist, but they might be different if you are speaking to someone else.
Yeah.
Right. So the question here from Vicky, and if we can, we'll try and keep them nice and snappy.
Okay. Sorry.
For those of you who are taking HRT, what would be a good supplement regime? E.g., my symptoms have been reduced on HRT, but they're ramping back up, and I was hoping to come off them soonish. So that's quite broad, but is there any good supplement regimes?
It depends on what the symptoms are. Yeah.
Okay.
So with something like that, you probably would be a good idea to see a herbalist.
Sure.
Yeah. Sorry, that was a bit generic, but it really depends. Is the answer to that.
Eileen says, "Hi, I'm interested in hearing what I can take to relieve the symptoms of hot flushes and night sweats whilst breastfeeding." So breastfeeding, obviously, you're quite limited with what you can take.
Breastfeeding, now that's a good point, because sage is used for drying up night sweats. It's also used for drying up breast milk. So do not take sage if you're breastfeeding.
Really good point there.
Yeah. So why are you having night sweats when you're breastfeeding? Yeah, we'd have to think about that one.
Okay.
Yeah.
Perfect. The other thing we can do as well, which I'm going to spring on our moderator, is we will try to contact you all directly after. So we'll send an email out, and you can fire your questions back to us, and then we'll discuss those with Wendy as well if we can't get through them all on this last 10 minutes.
Okay.
Cheryl has asked, "I would like to know best approach if not on HRT, but having brain fog and joint ache. I am 60 and periods ended at 57, so a natural menopause."
Okay. So no medication, you said? And brain fog?
Not on HRT at least, so there might be medication, but not on HRT.
Right, okay, so brain fog wise, so there's a couple of things. So lemon balm tea is fantastic. Black cohosh should probably be worth thinking about as well. Again, just checking with medication with that, but that's great for the joint pain and things, and it's phytoestrogen, so it might help a bit there as well. Get onto your rosemary tea as well. Lion's mane mushroom can be really helpful.
Oh, yeah, that's really good for cognitive.
Yeah, cognitive function, keeping on it. And one I quite like as well is I like lion's mane and cordyceps to take them on clinic days to keep myself
sharp. Lisa has asked, HRT is not working for me. I feel fatigued, bloated, and mentally feeling depressed with an impending sense of doom. Definitely not myself. What options are available for me? I'm really sorry to hear that, Lisa, that you're going through that.
That's rubbish, So I would be thinking liver with you. So definitely liver herbs, but that's a herbalist one, really feeling like that. Milk thistle could be helpful.
That can be taken as capsules or tinctures as well.
We've got the capsules there, but that can be really helpful. You probably better see a herbalist.
Kelly has said, "I find my skin has become so sensitive and hair has gone brittle. Only want to take natural remedies. I've been taking maca root and red clover tea. Any other suggestions? Are they quite good suggestions?
They're really good, yeah. And that's really a good point. So sensitivity can really ramp up. People can suddenly get hay fever or food intolerances where they never have before.
So nettle tea for hay fever?
Nettle tea is a good antihistamine. It's great for your skin anyway. And itchy skin can happen due to kidney stuff and liver stuff happening. So yeah, nettle tea would be helpful there. Probiotics might be helpful. There's lots of things that could be helpful there.
Brilliant. What I'm sensing is we might be able to put together some blog articles based on some of these people's experiences.
Absolutely. Yeah, that would be great.
Ruth says, I'm Ruth. Hi Ruth. Can you advise on best supplements for brain fog? We've kind of covered that. When suffering fibroids, so not wanting HRT type supplements. So I think you've covered some of those.
Yeah, so fibroids, you don't really want your phytoestrogens either. So yeah, we're avoiding feeding the fibroids, and hopefully they'll go away soon because if you're in menopause. But yeah, so and also just sniff that rosemary and massage it into your head.
So rosemary oil was that?
Ginkgo is another one. It's really good. There's lots. Lion's mane.
Vicky says thoughts on mushroom supplements to aid some of the symptoms. So that's exactly what Wendy just ended on there.
Yeah, reishi at night. I take reishi at night with my magnesium. It's wonderful and really relaxing and good if it's a bit of anxiety or insomnia. Yeah, lion's mane and cordyceps during the day for a bit of energy, a bit of mental cognitive stuff. Yeah,
fantastic. Eileen asks, is there a natural way to reduce FSH levels, please? I am not familiar with FSH levels. I don't know if that's something you're...
Yeah, that would be a herbalist.
That'd be a herbalist. Yeah, it's quite complex. Sorry, Eileen, we'd have to answer that separately.
Sorry.
And ask any advice for joint pain stiffness would be welcome. She's old, I think. Omega oils incorporated in diet, no sugar, etc. Post-menopause, no HRT.
Yeah, that's good. Yeah, because sugar is a real inflammatory driver, so it's good. Yeah, low sugar is good. Have you tried magnesium topically? Like using it as a spray can sometimes be helpful. Black cohosh can be helpful. There's lots of other things that are not coming to mind right now, but yeah, there are lots of things. We've got a good capsicum and ginger cream can be really good to help with circulation around the joints. We do that over the counter. Magnesium internally as well. Yeah.
Okay, brilliant. Let's have a look. Ella, any advice you can give us about genitourinary symptoms, please?
Yes, UTIs.
Yes. Sorry.
Yeah, so thrush, UTIs, that definitely is part of menopause, unfortunately, for some people. And that is because the acidity in the vaginal area changes. So you can take, there's specific probiotics you can take for women that actually work on that area. That can really help. Buku compound for acute symptoms of UTIs is helpful. Reducing sugar, phytoestrogens can be helpful as well.
Is something like cranberry extract?
Cranberry extract, well, D-mannose is what I was going to say is my favourite, because cranberry, so some people do cranberry juice, but it's so full of sugar.
You're kind of then feeding that issue, right?
So D-mannose is like the extracted sugar, of which I've just said no sugar, but this is a type of sugar that stops any infection sticking to the walls of the UTI, so that can be really helpful too. But Buku compound is the reason I'm a herbalist. That's
is that what got you to? Oh, really? Yeah. That's very interesting.
This very thing, yeah. So when I was in my early 20s, I was
experiencing recurring
UTIs, going to the doctor, getting antibiotics, getting thrush, and then getting another UTI. It was miserable.
It's vicious, isn't it? It's a horrible thing to go through.
So came into Napiers, because I lived in Edinburgh then as well, and they gave me that over the counter. It works, and I ended up working here and training as a herbalist. And that was in 1997.
We're still going strong, and still the same product is still here.
Yeah, I think it's slightly reformulated, but it's pretty much the same. Yeah.
Brilliant.
Yeah.
Lynn asks, can we use midlife mix and midlife tea if we're on HRT? Also, which nettle product is best for hair, skin, and nails?
Okay, nettle-wise, strong herbal tea, because minerals are water soluble.
Okay.
Yeah, so let them steep even overnight, and then drink it during the day. And you can eat nettles as well, nettle soup.
Yes, if you want to go foraging.
Not this time of year.
Not this time of year.
This time of year.
So more in the summer.
Yeah, more in the spring.
In the spring.
In the spring, you want it before it flowers. This time of year, nettle seeds as well are really good, but they're quite stimulating. So don't take them at bedtime. Take them in the morning. Sprinkle them on your porridge. Sorry, what was the other question?
Midlife mix and midlife tea. If you're on HRT.
If you're on HRT, I mean, it probably won't really register that much against an artificial hormone
Okay.
in terms of the phytoestrogens in there, but the sage probably would help a bit anyway, and the St John's wort. But to be honest, I probably wouldn't take St John's wort with HRT because it could affect the efficacy of the HRT.
Okay.
So no to that one. Is that the midlife?
I'm going to have to really rush you along because we're in the last 2 minutes, unfortunately.
Probably no then, yeah.
No, but drop us a message and we can maybe look into that further for you. So unfortunately, I'm really sorry that we do have to end 8 o'clock sharp, just the way our systems are set up at the moment. But this has been amazing in terms of the questions that we've received. We may even do a Q&A session based on it because I think that'd be really useful for us, for myself, being in the shop, but also for the viewers. I don't know if you want to say anything, Wendy, just to sign off. Obviously, you are available for consultations if people would like to book in. And
please don't give up. If you've taken HRT or whatever and it doesn't work for you, it doesn't mean nothing's going to work for you. There's always going to be things that can help. So
yes, and you're not going through this on your own. There are, at least even on this live, there are over 80 other people who are going through it, and all of your symptoms might be unique to you, but there will be other people going through it as well. And would you suggest very quickly just to be honest with family members, and once they have it confirmed that they are obviously going through this, just be honest with what they're going through? I think that's important as well.
Absolutely, talk about it. Yeah, but women are good at talking about these things. But yeah, talk about it more. Yeah.
Brilliant. Well, thank you all very, very much, and we'll be in touch. Wish you all the best.